Hello, my name is Rob Zynosky from Gallagher Home Health. I'm a registered nurse and marketer for the Pittsburgh and Eastern region. I hope you enjoy our new health and wellness videos today. Thank you.
Hi, I'm Diane Karcz, owner of Gallagher Home Health and Services. I'm here today with Dr. Timothy Campbell, our Chief Medical Officer. Today we're going to talk about COVID, but not COVID the virus, COVID and what can you do next?
You know, there's a lot of things that people are worried about with the masks and the social distancing. But one thing that's not touched on very often, Diane, is often people won't address like a lot of the stressors that are involved with it. You know, there's a lot of stress of, worrying if you're going to be able to continue with your job, being at home, schooling, for instance. People worry about the uncertainty of plans that they may have. I have a daughter who's going to be married in the next 3 months, and she's still up in the air. What to do? What am I going to do with this? How are we going to arrange it? So it's important to talk a lot about those issues in particular.
What are some of the things people could do to get themselves through this pandemic?
The first thing is to concentrate on yourself, to take care of yourself. If folks are suffering physically, they'll often suffer emotionally. They'll often suffer mentally, intellectually. So it's important to take care of yourself. And there's a lot of different things that can be done. In particular, sleep. Sleep is so important not only for restorative properties, what it could do for you, but it does a lot for your mental health as well.
Sure.
And a lot of people think, you need 8 hours a night. That's not true. You need what's right for you, the amount of time of sleep that's available for you. But it's important to have good sleep quality. So have like a little fan going on in the background when you're sleeping at night. Maybe blacken out the room, darken the curtains as much as you possibly can. Don't do a lot of physical activity or getting bright lights right before you pop in bed. That could affect your sleep to some degree. Physical activity. I've always said that therapy, physical activity in any capacity, it's cheap therapy. It's a good way to charge your batteries, in so many ways. And again, it influences every single part of our lives. Other thing is nutrition. A lot of people don't pay as much attention to that as we really should, and it's mission critical to keep up with the good fruits and vegetables. Get yourself the minerals and the vitamins you have. Most people think you could take a vitamin and it replaces, eating crap
Right.
and then just taking a vitamin. That's not the case. You need to have the proper macronutrients. And we're not going to do this as a nutritional lecture, but most folks know pretty much what they should be doing as far as eating well. But there's a lot of other things that can be done for stress management. Getting outside. There's something very therapeutic about being outside. Being in nature, doing some gardening, getting dirt under your fingernails. I love to do that. I had so much fun. It's cheap therapy for me as well. Playing with pets, connecting with family, with children, especially with the COVID constraints. People aren't traveling as much. They may have loved ones who are in nursing homes and may not be able to be visited. And it's so important for them to be connected to. And we've got a lot of technology means of doing this today. Skype and Facebook and Zoom meetings, or even just visiting somebody at a window, sending a card, snail mailing, doing things like that makes a big difference.
I've had a lot of calls about my grandchildren are now going back to school. Does this mean I can't see them until they get out of school?
No. Again, provided we stick with the proper constraints, as long as we're doing the things that we should be doing, like the face mask, the social distancing. No, there's really not a lot of restrictions beyond that. I have now had 6 deployments for COVID since the beginning of the year.
You sure have.
And we've had thousands of, if not tens of thousands of responders out treating these people, hundreds of thousands of patients who are COVID positive. And not a single one of my responders have converted, provided they do the things that they should be doing, the hand washing, the gelling, the social distancing.
And wearing their mask.
And wearing their mask,
Yep.
of course. So, of course, that's scary for a lot of folks because there's a lot of unknowns. But, we don't need to be imperfect with all that or perfect with all this. There's no scorecard. We want to do the best of doing what we can with what we have. That's so important. We don't have to be perfect in all things, especially with this. And we need to realize that. And there's some mental health in acknowledging that as well.
And people should reach out if they are so depressed or feel completely destroyed by being by the effects of the pandemic.
If it's to a degree where it's really influencing somebody's life, especially if it's compromising their sleep, their ability to know joy, connect, they know that they're socially withdrawing, or participating in behaviors, abusive behaviors that they hadn't had previously, substance abuse, for instance, or just snapping out of loved ones, then that's maybe a time to seek professional help with it as well. There's a lot of psychiatrists, a lot of psychologists who are very actively engaged with the stress that's taking place with the COVID-19 pandemic.
For sure. If there's anything you all would like to ask us about COVID, we will have a channel where you can send in your questions and we can do further videos to answer your questions. Thanks so much for listening. This is Dr. Campbell and Diane checking out.
See you, folks. Bye-bye.
Go,